Did you know that in kids with eczema and asthma, 50 to 80% of them also have environmental allergies? My name is Sheila Kilbane. I'm a board-certified integrative pediatrician in Charlotte, North Carolina, and I help parents get to the root of their child's health issues. This is our YouTube channel, and if you're new here, please subscribe below so you're the first to hear and see the new content that we put out. We also have a great email list you can join. The link is below. And share this information with any family you think might be helped by this information. I'm a pediatrician, so we talk about kids, but this information is applicable to all ages. In this video, I'm going to talk about what to look for and how to address recurrent and chronic eczema and asthma with regard to environmental allergies. The number one thing we miss in our training in medical school and residency is that inflammation is the common driver behind eczema, asthma, and allergies. We can't always get rid of these illnesses, but what we can do is understand what the triggers of inflammation are and decrease your child's exposure to them. I'm going to talk about two cases. One case is of a child I just saw this morning in clinic, and it's a 2-year-old boy with severe eczema. He'd had multiple rounds of ear infections, multiple antibiotics. He had molluscum, which is the little white dots. It's a virus, molluscum contagiosum, on his skin. He's up all night itching, scratching because of the eczema, has wheezing, has needed several rounds of albuterol to help his wheezing episodes. Those are the main things that he had. So in looking at him, we go through, all right, what are the 5 triggers of inflammation? Food, environmental allergies, environmental toxins, infectious diseases, and stress. And stress can be physical and it can be emotional. So we go through, and for this little boy, dairy, he was drinking a whole lot of dairy. We pulled the dairy out of his diet and eczema improved significantly. We also used a topical. It's a combination product that includes an antibiotic, and it helps to decrease the inflammation. So number 2 is infection, and that is addressing the staph bacteria that's on his skin, and that starts to decrease that inflammation and it starts to let the skin heal. We also, with him, used an antihistamine. So histamines are part of what drive the itching, the irritability, the trouble sleeping, and chronic runny nose, congestion, wheezing. And so for a lot of these kids, we started an antihistamine as well. Just all of this helps to, it's kind of brings down the fire, puts out the fire, so that then we can do deeper work. The third thing that we figured out with this little boy is that he had mold exposure. So the mold goes in the environmental toxin category, and the family found that they had mold in their HVAC and in their crawl space. So they're addressing that while we don't have to wait until that's completely finished in their home. Sometimes it can be in schools, but we are addressing his system while they're getting their home addressed. And this little boy his skin is almost completely clear. We're doing a little bit of spot treatment on the areas that he's getting the spot treatment twice a day, but we should be able to get to the point when we completely address all of these triggers to where parents might only need to do spot treatment, hopefully not more than 1 or 2 times a month, and then eventually he won't need it anymore. But it's also when kids with eczema or asthma get sick, that's when they get a flare-up. So that was case number 1. The second case is Gary, and I write about him in my book, Healthy Kids, Happy Moms, 7 Steps to Heal and Prevent Common Childhood Illnesses. And he is on page 21 is where I start to talk about him. And what I did in my book is I laid things out in terms of the triggers of inflammation, and then I have the cup of inflammation so that you get a really clear picture about what is driving the inflammation. And then here's Gary's cup of inflammation. So when he came to see me, he's 4 or 5 years old and had had a really nice workup by his pediatrician, which included environmental allergy testing. And so for his history, he was nasal congestion, he was mouth breathing, he was having recurrent episodes of wheezing where he was needing albuterol. And then he had a course where he had to get steroids orally, and he reacted. He had a big reaction to the steroids, and he kind of went bonkers. So mom knew that she couldn't do steroids again with him. And so that's why they came to see an integrative person. So in going through his history, he was colicky, refluxy as a baby, which makes us think about a dairy sensitivity, along with the nasal congestion, the mouth breathing. He was like that Darth Vader breathing, and then he had dark circles under his eyes. So when I went through the environmental allergy testing, his dust mite allergy was over 100, which is really high. Positive is over 0.1. And doing the history with his environmental history, he was sleeping on an old mattress that had been his uncle's from when his uncle was in college, which means it will be high in dust mites. So we knew he had a dust mite allergy and a dairy sensitivity based on his history. So we got rid of his mattress, mom took out dairy, and really in 2 to 3 weeks, he was like a different kiddo. He was breathing better and sleeping better. And when a kiddo, because of his family history, so he had family history of what we call atopic or allergy disease, plus what was going on with him currently, put him at a higher risk for asthma. So he was 9.8 times higher risk of going on to develop asthma. And later, when I was writing the book, I reached out to the mom, and this was probably 15 years ago that I saw him at least. He did not go on to develop asthma. He would use his albuterol possibly once a year, but when we make these modifications early on, potentially we can shift the course of the kid's illnesses, even what we statistically, think will be happening based on our scientific studies. And the other things that we did these with both of these kids, is we use food and supplements to support their systems while we're addressing those underlying causes. We have our integrative supplement guide. So if you go on the website to look at the supplements, we've got cards and we have dosing by age. And we have an asthma jumpstart bundle and an eczema jumpstart bundle. And it's really because there's inflammation and there's immune dysregulation. So what happens with eczema and asthma is we get a big increase in inflammation when they get exposed to their triggers. So it's sort of like the body says whoosh and sends all this inflammation to the lungs or to the skin. And so by using the supplements in food, we start to decrease the inflammation internally while we use whatever medications we need to externally, right? Steroids are what these kids often get put on, and that's an external decreaser of inflammation, and we're going to use food and supplements and decreasing the triggers of inflammation internally. So we start with a probiotic, then we move on to a digestive enzyme, and then we use omega-3 fats, right, in the form of fish oil usually. That helps to create really healthy cell walls. Then for many of the kids, we will use something called phosphatidylcholine, which also helps to create good healthy cell walls. We use magnesium in particular with kids with asthma, is that helps the muscles relax. And then we will use various other supplements based on the kids' testing, But again, we have that laid out in our eczema guide and the asthma bundle, in the eczema bundle. So again, we have many other videos, and I'm going to go into further detail on explaining asthma and then the supplements that we use to treat asthma, as well as environmental allergy testing, how we do it, and the supplements that we use for these things. Again, this is Sheila Kilbane. I'm an integrative pediatrician. My goal is, and my mission is, to get 1 million kids off of medications they may not need. So subscribe to our channel, and please share this with anyone you think might be helped by this information.